Good afternoon, Dr. Fauci.
Good afternoon. Nice to be with you.
I'm Leonard Forsman. I'm president of Affiliated Tribes of Northwest Indians, and I'm here in our tribe, where I'm the chairman here in Suquamish, home of Chief Seattle, near Seattle. And we have many of our representatives from our Northwest tribes. You really don't need any introduction, but I would like to welcome Dr. Anthony Fauci, Chief Medical Advisor to President Joe Biden and Director of the National Institute of Allergy and Infectious Diseases. Have you been to the Northwest before?
I certainly have. I've been to Seattle. I've been to Oregon. I've been there.
Okay, we got plenty of representatives from there. We wanted to find out a little bit about an opening question just regarding vaccine hesitancy, and we've been having some challenges with that, like the rest of the country, with our younger people. And also with our workforces. A lot of us employ quite a few people in our governments and our businesses, and just kind of give a lay of the land on that. And anything else you might have to say about your experience with the pandemic in Indian country. And just once before you answer, I just want to say thank you so much for your decades of work to help keeping us healthy.
Well, thank you. That's very nice of you. Well, I mean, the issue with vaccine hesitancy is really, it's certainly not unidimensional. There are different reasons why people are hesitant to be vaccinated. Some because of concerns about safety, some of concerns about the entire process of testing. And in order to overcome vaccine hesitancy, it's important to first of all, not to be finger pointing and accusatory to people who don't want to get vaccinated, but to try and reach out to them and figure out what is the reason why they're hesitant. Is it a valid reason based on a valid concern? If so, try to address the concern. The thing that we have found really quite effective in addressing optimally the issue of hesitancy is to get trusted messengers that the people rely on and have confidence in to try and explain to them the reasons why it's important for one's own health, the health of one's family, and the health of one's community. Whatever that community is, it could be a tribe, it could be, a congregation of people who will be protected. When individuals get vaccinated, it makes it less likely that there'll be spread of infection in the community. So you're not only protecting yourself, but you really are contributing to essentially breaking the cycle of transmission of the virus. So vaccine hesitancy is real. You got to deal with it, but you got to deal with it in a straightforward, honest way to try and convince people why it's so important for them to get vaccinated.
Thank you. We have many questions about vaccinations for minor children. Many of us have been using the Moderna vaccine because it was this user-friendly storage requirements. Is there an estimate when Moderna will be authorized for use with teenagers?
No, they're actually working on that right now. As you know, Pfizer in a clinical trial has shown that 12 to 15-year-olds, it's safe, it's highly effective. And that's the reason why 12 to 15-year-olds, but not only Moderna, but other companies, J&J, are doing studies which are called age de-escalation studies. Namely, if you've already shown it's okay from 12 to 15, then you work your way down 12 years to 9 years old, 9 years old to 6 years old, 6 years old to 2 years old, and then 6 months to 2 years old. It is anticipated that by the time we get to the end of this calendar year and the first quarter of 2022, that there will be enough information regarding the safety and the efficacy and the immunogenicity among children of any age that we will be able to vaccinate children of any age by the time we get into the first quarter of 2022.
Have there been any side effects that you've heard about so far in the trials?
There are always side effects. Almost all of them are relatively minor. You have to be distinguishing between what's called reactogenicity, which some interpret as side effects, versus adverse events. Let me explain what the difference between the two is. So I got vaccinated with Pfizer. The first dose, I had an ache in my arm that lasted about 18 hours, then went away. 4 weeks later, I got the boost. And then within a period of about 8 to 10 hours that lasted for about, I'd say 24 hours at the most, I felt very fatigued, a bit achy, some temperature dysregulation, felt a little chilly. That's what's called reactogenicity. An adverse event is some people, for example, have developed anaphylactic reactions, namely allergic reactions. It's been very, very rare, almost always in people who have a history of anaphylactic reaction. Again, very, very rare. So the answer to your question is yes, there have been reports of adverse events. They have all been reversible to my knowledge. Maybe there are some have not been, but I believe they've all been reversible. But when you balance what the adverse consequences of getting COVID-19, particularly if you are in a risk category with underlying comorbidities, versus the minusculely small likelihood that you're going to get an adverse reaction to the vaccine, the weight of evidence weighs very, very strongly in getting vaccinated.
Do you anticipate that the coronavirus could become a seasonal disease like the flu? And should we expect annual vaccinations? And I assume the potential for boosters as well.
Well, we don't know right now. We would hope that we could ultimately crush this virus. When you're dealing with viruses or any other pathogens, there are three major things that happen as you confront them. You can eradicate them. That is very difficult. There's only been one human virus that's been successfully eradicated, and that's smallpox. You can eliminate it, which means you don't eradicate it, it's somewhere, but you've eliminated it from your geographic location. For example, we've eliminated polio, transmissible polio in the United States. We've eliminated measles for the most part in the United States. And then if you don't eliminate, there's control, which means there's always this low level, it might be seasonal, that is under reasonably good control, that doesn't pose serious public health hazard. You're asking the question, is it conceivable that we may have always a low level of this, that we would have to intermittently boost people to keep up protection? And the answer is, I don't know if that's the case, but I would not be surprised if intermittently, whether that's once every few years, once every year, we just don't know that because we don't have that much experience with this virus and the durability of the protection of the vaccine. We know for sure that the vaccine is highly effective in protecting you for clinical disease and even for asymptomatic infection, and is very good against the variants that are circulating. So we're very fortunate that we have a really good set of vaccines that are available to us. The only thing that's the wild card that we're not 100% sure is, as you're alluding to, what the durability of the protection is. We think it's going to be pretty good, but that remains to be seen.
I was going to shift a little bit to the last two subjects. One is regarding the impacts of COVID-19 on minor children that have contracted it, and have you seen any long-term impacts on teenagers, et cetera, that have contracted COVID-19?
Well, certainly anyone can get infected, even though among young people, the likelihood of having a severe outcome is significantly less than the likelihood of a severe outcome when you're dealing with an elderly individual or a person with an underlying medical condition that would make it more likely that they would have a serious outcome requiring hospitalization and even death. So that's the first thing. Yet, there are clear-cut documented instances of young individuals, teenagers, adolescents, and people, kids even younger than that, who have had severe outcomes. Also, there's this issue of long COVID, where if you get infected, even after you clear the virus from the body, there are a certain proportion of people who have lingering symptoms, some of which can be incapacitated: fatigue, muscle ache, sleep disorders, lack of concentration. So you don't want to get infected. That's the reason why, even with children, where the risk of a severe outcome is much less than the elderly and those with underlying conditions, you still want to prevent children from getting infected, which is the reason why we've done the studies, at least with Pfizer, in 12 to 15-year-olds, and other companies are going to be doing studies, as I mentioned, in an age de-escalation approach for kids of younger age.
I know you get a lot of questions about the CDC and their masking recommendations. And maybe you could update us on what the latest is on that, considering that a lot of us have businesses or governments that have been closed. Tribes have a long history with pandemics through our oral history, the impacts of the first explorers when they first came here. So we've been pretty strict on that, but want to know when you might feel it's, what's the best approach for us for reopening businesses and masking requirements?
Well, the best approach is get vaccinated. Really, I mean that, because we know now that with the proportion of people that are vaccinated, it's associated with a remarkable diminution in the number of cases per day. We've gone down literally every week over the last several weeks. We've diminished the number of cases from 60,000 per day to 50 to 40 to now less than 30, and it keeps coming down. That's due to the fact that we have about 60% of the adult population in the United States has received at least one dose, and about 40% are completely vaccinated of the adult population. If we get the president's goal of 70% of the adult population having received at least one dose by the 4th of July, I believe strongly that you're going to see a dramatic diminution in the number of cases. Now, with regard to the masking situation, based on evidence of the high degree of effectiveness of the vaccine, not only in preventing symptomatic disease, but protecting against variants and also protecting against asymptomatic infection, whereas it's unlikely that you're going to transmit it to someone else. The CDC has said that if you are fully vaccinated, that you really can feel safe without wearing a mask, either outdoors or indoors. That should not be interpreted to mean that people who are unvaccinated now don't have to wear masks. So that's the reason why many owners of establishments are saying, well, I understand that people who are vaccinated fully can feel safe both indoors and outdoors without a mask. If I open up my establishment, my store, my factory, whatever, and I don't know who's vaccinated or not, because we don't have vaccine passports, we don't have verifications of people vaccinated, that there may be people who walk into an establishment who are not vaccinated, who might actually be infected and may have the possibility of transmitting the infection to someone else. So some are saying, well, if you're going to come into this establishment, you really have to wear a mask. So some people get confused and say, wait a minute, I'm vaccinated and the CDC said you don't have to wear a mask indoors. What are you talking about? And the fact is, because you don't know a guarantee if everyone is vaccinated. So if you're in a situation where an establishment says, if you come in here, you got to have a mask, whether you're vaccinated or not, you should be wearing a mask.
Thank you. What about the, we had a question about people who are compromised and the other types of treatments outside of the vaccine that are used to treat COVID-19, and whether or not that's worked on children or if it's working So it's basically for those who have compromised systems, who can't get the vaccine, how do you feel about some of the alternatives out there, like remdesivir, et cetera?
Well, we got to be careful because we want to distinguish prevention from treatment if you've been infected. So whether or not you're vaccinated or not, if you get infected and you get sick, there are a number of treatments you can give. If people get vaccinated who have underlying conditions that suppress their immune system, which means they may not make an adequate response to the vaccine. We're seeing that relatively commonly in people who have organ transplants and who are on immunosuppressive drugs to prevent them from rejecting their organ transplant. With those people, they may not have an adequate response to the vaccine. So if they get infected, you're going to want to make sure you treat them quickly. And one of the ways is to treat them with monoclonal antibodies. If you treat people early enough, you can prevent them from requiring hospitalizations.
Regarding that, you mentioned things about businesses, and does it go for, as far as masking, does that go for schools as well? Is there anything different that's happening in schools with masking? Like the vaccinated kids, should they wear a mask, et cetera, et cetera?
Well, you know, and when you're talking about elementary school, those kids are not going to be vaccinated because it hasn't been approved for them yet. If you're talking about high school kids, that if they are vaccinated, again, it depends on if everyone's vaccinated, because you can't have an honor system and say, well, you're vaccinated or not. So there are going to be school systems that are going to likely require kids to be masked in school if you don't know the vaccine status of everyone in the class. And this is particularly of elementary schools where kids could not have been vaccinated because it has not been approved yet for children that young. So there are schools that will likely say that you need to get wearing a mask while you are in school. And again, that's going to vary for a number of reasons. It's going to vary depending on the level of infection in the community. We hope that by the time we get to the fall, all schools are going to be open for face-to-face, in-person training, as opposed to virtual, the way we've had to do over the last year.
Okay, two more questions. We have one from a tribal leader here whose wife lost her sense of smell when she got infected. It's been 6 months and it's only returned to about a third. Is there anything she can do to help get it all the way back?
Well, that's not an uncommon problem. Generally, it continues to get better and better. We don't have enough experience over a period of years of how long it takes and whether there are some people in which it never completely comes back. So there's no known treatment to hasten the return of normal taste and smell. The thing to do is to just be patient, wait it out, and hopefully over a period of time, it will get better and better and improve.
Okay, I understand you played a little basketball in your day.
I did.
Okay, are you a Brooklyn Nets fan?
No, unfortunately, when I was in Brooklyn, where I was born and raised, the Brooklyn didn't have an NBA team. I was a New York Knickerbocker fan.
Okay. You're very loyal. That's good. We're still waiting for our Seattle Sonics to come back, and we'll get them back someday.
I hope so. They were a good team at one time.
Yes, and one of them's playing for Brooklyn now. Kevin Durant played in Seattle for 1 year, as you probably know.
Yeah.
So I just want to say thank you, Emma from ATNI, for coming in here on such kind of short notice for you and squeezing us into your schedule. And I'd like to thank your staff for getting you ready, and just the best to your family. And thank you so much for coming to ATNI. Really proud of you.
It's my pleasure. Thank you for having me, Leonard. I appreciate being with you.